Hello, my name is Wood Pope. I am a general orthopedic surgeon at Ortho, Georgia, specializing in shoulder, hip, and knee conditions. I would like to talk to you today about hip bursitis. Hip bursitis is characterized as one of the generators of lateral hip pain. Lateral hip pain is a common presenting symptom of many patients, and this can constitute several different diagnoses. This can be radiating lateral hip pain from a low back condition. It can be a condition of hip bursitis, which is really an inflammatory condition of the lateral side of the hip. I have a model here demonstrating the pelvis with a right hip socket and a right proximal femur. And the hip bursa, a bursa is a fluid-filled sac that its function in the body is to pad muscle and tendon as it crosses a prominent bony surface. We have a hip bursa in the hip, we have bursa in the knee, in the foot and ankle, in the shoulder, in the elbow. This fluid-filled sac, if it were to be overused or potentially even injured, potentially in a sporting event. Sometimes even folks complain of lateral hip pain when they lay on their side too much when sleeping. They will present with lateral hip pain, and it is typically worsened by increased standing, walking, steps, especially inclines. Typically on exam, we will notice pain with palpation of the lateral side of the hip. Usually the hip joint itself typically still moves very well, differentiating it from an arthritic hip. We will typically take an x-ray of the hip to confirm that the bony structure of the hip joint is sound. And then this is oftentimes treated initially with an oral or topical anti-inflammatory. Sometimes physical therapy can be employed for treatment of hip bursitis. And ultimately, a steroid injection into the hip bursa is oftentimes very helpful. If you feel like you're suffering from lateral hip pain and need to be evaluated for potentially hip bursitis, please do not hesitate to call for an evaluation at Ortho, Georgia.